So thank you very much for your brilliant presentation on hematopoietic stem cell transplantation, both in auto and allogenic transplant, when to do, how to do, everything you have elaborated in time. Thank you very much. Our next speaker is Dr. Rumi, who has just experienced his observership in UK, and he will be delivered his speech on multidisciplinary team approach, his experience.
Assalamu alaikum. Welcome to all in today's scientific seminar. I am very much grateful to all of you as you gave me opportunity to present in today's session. So as there is some time limitation, without further delay, I am going to present my case. So today's topic, multidisciplinary team approach in hematology, UK experience. And today's host, Hematology Society of Bangladesh. I am Dr. Shahidul Sikder Rumi, working as Assistant Professor in Department of Hematology, BIHS, General Hospital. So before going in details, just little bit background. You already know that BADAS is a big organization and serving in different sectors in our medical field actually. They started their journey for the diabetic patient. Day by day, they extended their service for the different medical sectors. Recently published data, you already know that in 2020, newly diagnosed hematological malignancy number was around 7,500 and the mortality was around 5,000. So this clearly indicating us that the hematology malignancy day by day increasing, and from this realization, BADAS authority trying to extend their hand in this sector as well. But the diagnostic sector and the modern treatment facilities is still now, there is a big gap in our country, and they're trying to change this scenario actually. So they took initiative to establish a cancer center, already designed, DPP, feasibility, all are prepared. So before establishing center, they're trying to develop skilled manpower, and from this initiative, I actually went to UK, sponsored around 60% given by the authority and remaining 40% from myself actually. So this is the actual acknowledgement of for my training actually. So already you know the cancer treatment individually never possible. Separate institution can never give whole treatment facility. So we should build up multidisciplinary team approach, and for this reason we need good team. So today I try to focus within short period of time that how they develop good team, how they maintaining good teamwork, and what is the role of multidisciplinary approach and how they maintaining this approach actually. So this is the academic center of my hospital, and I started my journey from this academic building. I am not going in details regarding this slide. So this is the hospital building. So in picture you can see only the 15 or 20% of the total hospital tower building block, remaining 80% out of the picture. And this hospital run by the 415 consultant in their MRCP or equivalent MRCP degree, not a consultant degree. So just entry degree for the training purpose actually. So 415 consultant run this hospital. And this is the hematology department, official department. One room you can see, and there are another 8 rooms. From this department, they perform online OPD consultation, other administrative work. So here transfusion medicine room available, and another room for the chemotherapy sister, students, register, and as well as for the consultant. So there are another 2 dedicated, highly decorated ward for the hematology and oncology patient. So another building they dedicated, established for the chemotherapy daycare service. And another room or building they provide for the outpatient department management. So all are separate. Just one thing, from this picture you just observing few points how they actually maintaining good team. So adopting various diversity with honor, such as region, religion, race, hair pattern, dress up, grooming, everything. So you can think that this is simple, but this is very much important. They are adopting this kind of issue in a liberal way, but we are very much sensitive. So this is a big point to make a good team. But they are very much concerned regarding the second point. What is that? Professionalism, and highly concerned regarding their service quality. But most probably we are a little bit lacking in the second portion. So this is the big point to develop a good team. Third issue, everyone knows their boundary as well as they know their access. And they have good trust on each other. First few days, I just asked them, where is Khata to give my attendance? Where is finger punching machine? And one time they mentioned there is no scope to do this kind of. So I mentioned how I can show my attendance. They just politely mentioned big information, that there are so many confidential information, so many assets they give only on the basis of trust. So considering this issue, your attendance, delay come, early leaving, or other things, this is very much silly matter. So we will come on your own accountability and we will live on your own accountability. So this is a big theme to make a good team work actually. Freedom, respect to others, and healthy cooperative working environment. So in my total training period, I never observed any shouting, any humiliating, any destructive criticism, throwing of objects, other activities that we daily observing in our primary school, in our religious school, in our medical sector. And this is a big barrier to develop a good team. But it is an integral part and parcel of our academic sector. So we should think about how they develop good thing, and we should think about why we fail to develop a good team. This is the IPD and OPD management scenario. I am not going in details, just follow the last line actually. Their prescription writing, referral writing, other administrative activity writing, all done by a dedicated medical secretary team, not by the doctor. I just asked them, why you are doing like this way? You are using so many expert manpower by this way. They just mentioned, no, because we are using this manpower and spending money. Actually, by this way, we are saving money. But how? They mentioned that consultant is the main driver of all medical activity. So we are creating much more scope to do many activities by the consultant, and by this way we are earning many things, but we are not losing many things. So this is the theme that we are engaging consultant for so many activities. Actually, they fail to give proper concentration for students, for research, for other things. So for making a good team, this is another important point. This is just a picture that how they prepared referral. This most of the paper written by the secretary and then observed and approved by the consultant. So this is the hard copy formula for multidisciplinary team meeting. I will discuss little bit later. Just observe. This is the daily meeting hard copy actually. So this is the lymphoma MDT meeting. Every week there is a slot for lymphoma patient discussion. And this is a leukemia MDT meeting hard copy. And this is chemotherapy organogram, how they give chemotherapy. First line, just try to understand. Final diagnosis and treatment protocol set up by MDT meeting. So diagnosis not by the individual, diagnosis not by the institution, diagnosis made by the teamwork, and protocol set up by the teamwork. In UK, nobody allowed to give any definitive treatment for any leukemia or lymphoma patient without passing the MDT meeting. That's the beauty. So we are practicing most of the cases in our chamber practice, in our hospital practice, individual. So when approved any treatment by the MDT meeting, then chemo pharmacist take the responsibility. After then chemo nurse. Just try to last line that when a patient selected for a chemotherapy, first 2 or 3 cycles totally deal by the chemo nurse. All follow up, all the complication primary related to the chemotherapy, all are managed by the sister. If any emergency develop, they request to the patient come to accident and emergency department, and according to need, all the other relative department engaged for the management of patient. So they train nursing department and pharmacist department. So by this way, they are giving much more definitive good service, but we are lacking most probably in this sector. So another issue, how they are developing good team member. So just you can see that my mentor, Professor Dr. Amin Islam, he is giving speech in grand round. Another Dr. Lena, these two person at that time giving speech in MDT meeting. This is not the real message. Real message in the next this slide. So you can see the feedback from the grand round. So here 7% give feedback. Out of 7, 5 was consultant. Another one was junior doctor, and another one was non-doctor person. So what is their message? What was the content of the presentation? What was the way of presentation? Like this, many things. So each and every activity, actually they give feedback. By this way, the trainee can know what is their positive point, what is their negative point. And this is the passive message to the mentor that this is not the status of your trainee, actually this is the status of yourself as well. So consultant become little bit conscious by this way. And just see, feedback taking and giving is a routine practice to improve service. I just focus immigration feedback, I just focus my hospital feedback. Each and every activity, after activity, they take feedback and want to assess what is their lackings, what is their good point. And in short, just we can say that without feedback, no assessment. No assessment, no improvement. So we have feedback system. We are practicing older way, most of the cases. Write down paper and submit to the director and they will assess. But this feedback, they are collected by a third party, evaluated by a third party, and they then take necessary steps generated by the third party. Just hospital lab, this is the door of the hospital, and the important thing, how they are maintaining good teamwork, good multidisciplinary team approach. This room actually provided for the microbiology, immunology, biochemistry, hematology, transfusion medicine, for everything. But there is no sound, neat and clean, good cooperation. And how they run their service? Most of the cases, they run their service by the biomedical scientists and clinical scientists. In that area, there is no doctor, no consultant. You can see the last line, very few number of slides, less than 5%, and critical test report come to the consultant for final evaluation and approval. But in our country, most of the consultant, apart from the hematology, their knowledge is like that each and every slide must be evaluated by a consultant. So we are losing actually resource capability of our consultant, and they are using maximum capacity of their consultant. This scenario showing that the transfusion medicine activity, you just see the lady, he is so knowledgeable, so dedicated, so experienced, but non-doctor person. All the transfusion activity done by herself under the umbrella of hematology department. First line, you just try to understand. Transfusion medicine department works as a wing of hematology department. So how can we develop our service? Our country scenario totally different from the modern country scenario. We are trying to develop independent department, but they are working independently, but under or as a wing of a hematology department. And in their hospital, there is no facility for blood collection. They collected blood in another central lab. They are allowed to store blood only in their hospital, and they can use that. So this slide, I am not going in details, just try to understand molecular microbiologist, immunologist, and another consultant of different laboratory site. Actually, they are much more engaged in clinical sector. They give ward round with consultants separately, with the chemopharmacist, with the antibiotic pharmacist, and they give little time in their lab. So by this way, they're giving much more good service for the patient. And just look at the histopathology lab scenario. Initially, each sample actually observed by the teamwork, 5 or 4 histopathologists working in that lab, and they generate a primary report. After then, this sample goes to a central lab, and this report or this sample finally evaluated by a central lab team, and finally they generate a final diagnosis. So you can realize from this scenario that how they giving good service. So if anybody diagnosed as a case of DLBCL, this is not the personal diagnosis, this is not the hospital diagnosis, this is the UK diagnosis, you can say. So in our country, when if you send 3 sample in 3 labs, most probably you will get 3 results from the 3 labs. And if you you can say that, is it true? Yes, I have a document within last 1 year, I faced this kind of scenario 2 times. So try to take message, hub lab. Why we failed to develop a teamwork, you just try to understand that this hub lab actually cover 3 hospital, big hospital, Basildon, Broomfield, Southend. And this hospital covers
sorry,
1,500
Dr. Rumi,
consultants.
you have 1 minute left. You have 1 minute left.
Okay. 1,500 and they develop to minimize cost this issue. And why they develop? They are developed countries, but they develop this activity to minimize cost, to maintain good service quality by the integration of connectivity and transport system. So this is the reality. Community mission may not be correct, but this is the true. And this is the MDT approach that actually I want to mention. My mentor giving speech regarding one case, and so many resource person connected through the online to take part in the MDT meeting. And this is the radiology picture, radiology directly connected, giving live documentary regarding the findings. There is no hidden issue, no paper generation. They have to answer cross question. And when histopathology team come, they just give the documentary message, live message. This is my findings, and for this reason, the diagnosis of this. So this is the competency test method. They receive sample, and by this a consultant, every laboratory person, every hospital staff giving their competency test. By there is here there is no system. I passed 2017. Still now I am active, good consultant. There is no competency test by our central policy. So I am just passing. This is the picture. And this is the collaboration, accreditation, quality improvement. So by this way, they are making the collaboration, accreditation, and quality improvement. So if you want, we can communicate through a proper channel. They will try to help you with. So realization, last slide actually. Realization from the observation, you can see that need integration, standard organogram, teamwork, long-term sustainable planning, dedication, enthusiasm, honesty. Last point is the big point. Non-practicing institutional job by ensuring standard salary as per designation. Without this point, this country can never develop good hematology service. So already you know, this is the message reality that what we are thinking, and this is the proposal already discussed in group, you already know. As there is time limitation, I am not going in details. So thank you all for giving me the scope. Assalamu alaikum.
Thank you, Dr. Rumi, for your brilliant and vibrant presentation, because many of us have done observership training or in kind of training in abroad, but we were not able to deliver like your presentation, what you have shown to us. Thanks for your presentation. So we will have now a presentation from Dr. Suthat Fusharion. So may I request Dr. Humaira, do you want to, but she doesn't want to talk in front, so I'm just giving him introduction. So Dr. Suthat Fusharion is a professor of emeritus at the Institute of Molecular Bioscience and previously the director of the Thalassemia Research Center, Mahidol University, Thailand. And he has a lot of works in national and international journal, and he has been the recipient of many honors, among them the Outstanding Researcher Award from the National Research Council of Thailand, Outstanding Scientist Award from the Foundation for the Promotion and Science Award, and Technology under the patronage of His Majesty of King of Thailand. The Royal Dujti Mala Medal in Science awarded by HM King of the Thailand. So Golden Silk Award and lot of award he already mentioned in his bio. So his clinical priorities is thalassemia, and Dr. Fusharion has delivered the Berend Howen Lecture in International Society of Laboratory Hematology in New Orleans in 2011. So let's listen from him. So may I request the technical person to connect with the Zoom. So can you hear us? Professor Dr. Shuchat Fusharian, can you hear us? শুনতে পাচ্ছে না বোধহয়, আপনারা একটু সাউন্ডটা দেখেন। Okay, so can you hear us? Dr. Suthat?
Yes.
Sir, do you hear us?
Yes.
Thank you, sir.
Good morning.
Good morning, sir. Sir, we hear the whole audience is waiting for your speech. So do you please start your talk?
Because I'm afraid that there is some problem in connection, I did my video record. Does it work?